There's a quiet kind of discomfort that many people over 60 are familiar with. It doesn't make headlines, and often, it's not even something you'd bring up with your doctor during a routine checkup, but it lingers, it distracts, and sometimes, it keeps you up at night. We're talking about itching, a simple symptom that most people dismiss as harmless. But in certain parts of the body, especially as you age, itching can be more than just a nuisance. It can be a warning sign. If you've noticed an unusual or persistent itch in one specific area, and it doesn't respond to moisturizers, or seems to return again and again, it may be time to look deeper. Because for older adults, itching can indicate something going wrong beneath the surface, an issue with your liver, your nerves, or even your blood sugar. It's not about jumping to conclusions or creating panic. It's about awareness, knowing what your body is telling you, and recognizing when that whisper of discomfort could be pointing to something more serious. Let's begin by understanding why itching changes as you get older, and then we'll explore 6 body areas where an itch may mean it's time to speak with your doctor. As we age, our skin naturally becomes thinner and loses its ability to retain moisture. This alone can cause generalized dryness, which may lead to occasional itchiness, particularly on the arms and legs. But when itching becomes localized, and when it's persistent, intense, or accompanied by other symptoms, it's no longer something to brush off. It may be a signal from an internal system struggling to function properly. The nerves, liver, kidneys, and even blood vessels can all contribute to sensations of itch, depending on where the issue is occurring. Importantly, for older adults, the underlying causes are often more serious than for younger individuals. That's because age increases the likelihood of chronic conditions, and itching can sometimes be one of the earliest signs that something is going wrong. Let's take a closer look at 6 body areas where itching should not be ignored. Each location tells a different story about what could be happening inside your body. The first area is the lower legs and ankles. If you're experiencing chronic itching in this region, especially if the skin is dry, discolored, or developing a rough texture, this could be a sign of poor circulation. As you age, the blood vessels in your legs become less efficient at transporting oxygen and nutrients. This is particularly common in people with peripheral artery disease (PAD), a condition where plaque builds up in the arteries of the legs, narrowing blood flow. The result is a kind of skin starvation, where the tissues aren't getting what they need to stay healthy. Over time, the skin on your lower legs may begin to flake, thicken, or itch. You might notice darkened areas, or even a shiny, tight appearance. Some people experience a dull ache or cramping in the calves, especially when walking. These symptoms may be dismissed as just getting older, but they could indicate restricted circulation, which, left untreated, can lead to ulcers, infections, or even limb-threatening complications. For seniors, particularly those with diabetes, hypertension, or a history of smoking, an itchy lower leg isn't just skin deep. It may be your body warning you that blood flow to your extremities is compromised. The second area of concern is the scalp. Now, it's true that the scalp naturally becomes drier with age, and it's common to experience some degree of flakiness or itch. But when itching becomes persistent, intense, or is accompanied by noticeable hair thinning, it could signal something beyond dryness. In older adults, chronic scalp itching may be related to neurological issues, particularly in cases of scalp pruritus with no obvious skin condition. This kind of itch is often neuropathic, meaning it originates from the nerves, not the skin. One possible cause is nerve degeneration in the cervical spine, especially in individuals who have arthritis or spinal compression. When the nerves in the upper neck are compressed, they can misfire, leading to sensations like burning, tingling, or itching on the scalp. This is sometimes referred to as brachioradial pruritus when it also affects the arms, but in older individuals, it can present only on the head. Itching of the scalp can also be associated with seborrheic dermatitis, a condition more common in older adults with weakened immune systems or those taking certain medications. But if no clear cause is found, and especially if the itch feels deep, almost like it's under the skin, consider asking your doctor about a possible neurological referral. Because for seniors, nerve-related itches can easily go undiagnosed for years. Let's move next to the back, particularly the upper back and shoulder blades. This is an area often ignored, simply because it's hard to see and hard to reach. But chronic itching here can indicate a surprisingly common condition in older adults known as notalgia paresthetica. This is a nerve entrapment syndrome where the spinal nerves that supply sensation to the upper back become compressed or irritated. The result is a deep, chronic itch, usually in a small area, just to one side of the spine, between the shoulder blades. This condition can persist for years and may be misdiagnosed as a skin allergy, eczema, or even dismissed as psychosomatic. But the true origin is neurological, stemming from age-related changes in the spine such as degenerative disc disease, osteoporosis, or arthritic bone growth that puts pressure on nerve roots. Importantly, the skin in the affected area may appear completely normal, or it might develop hyperpigmentation, darkening of the skin caused by repeated scratching. For seniors, this condition can significantly impact quality of life, interfering with sleep and leading to constant discomfort. Because it's neurological, typical creams and ointments may offer little to no relief. Recognizing that an itch on your back could be caused by nerve entrapment and not by a rash or allergy can make all the difference in treatment. Physical therapy, posture correction, and in some cases, medications for nerve pain can provide meaningful relief. These are just 3 areas: the lower legs, the scalp, and the upper back, where itching should never be ignored in older adults. Each location reflects a different system of the body that may be under strain: the vascular, the neurological, and the musculoskeletal. And in each case, the itch is not the problem itself, it's the body's attempt to signal that something is wrong. As we continue, we'll explore 3 more body areas where itching could be your body's early warning system. But what's important to remember, even now, is that when you're over 60, your skin isn't just a barrier, it's a messenger. And paying attention to what it's telling you may help prevent far more serious complications down the line. When itching occurs in the lower L, chronic V, Thichi SE, often worse I. Unlike simple dryness, this itch is often described as deep, almost internal, and may be accompanied by skin that feels thin or stretched. Seniors who scratch repeatedly may develop darkened, leathery patches on their legs, a condition known as stasis dermati left. In this context, the itch is not a surface-level nuisance, but a VASC. Now, we turn our attention to another overlooked area. The scalp. Seborrheic becomes. The scalp, like the rest of the skin, loses its oil balance and immune response capacity as we age. Glands that once regulated sebum production begin to behave unpredictably, sometimes underproducing, sometimes overproducing. The result is a breeding ground for yeast organisms such as molar. Why? What makes scalp itching medically significant in older adults is not just the risk of infection, it's also a potential ear for exam. Additionally, scalp itching can coincide with ear. The kind, equally subtle, but potentially more serious, is itching in the geni, atop vulvae leads to gatefo. For men, itching in the genital area can sometimes point to dermatologic-like lick. The critical point is this: genital itching in seniors is not a mere discomfort. It can be a signal of endocrine, immune, precancerous, for example vulva or bot. Another location that demands attention is the back or not a nerve. This is not a skin condition, it's an E, off or ear along the S. Treating notalgia paresthetica typically involves physical therapy, postural correction, and sometimes nerve-blocking medications. The key takeaway is that when itching occurs persistently on the back or shoulders in an older adult, particularly in a well-defined patch, it may be spinal in ori, and scratching eye. The aging body communicates in subtle ways, and itching, often dismissed as trivial, is one of those quiet signals that deserves your attention, not because every itch is dangerous, but because some are trying to warn you before something becomes irreversible. Among the areas of the body where itching could signal a serious condition, the palms are often overlooked. It might sound strange, but persistent itching on the palms, especially when there's no rash or dry skin, can be an early sign of liver or bile duct disorders. In seniors, illnesses like cholestasis, primary biliary cirrhosis, or chronic hepatitis can cause bile salts to accumulate in the bloodstream. When bile salts reach high concentrations, they stimulate nerve endings under the skin, particularly in sensitive areas like the palms. What's important to understand is that liver-related itching is different from dry skin. It tends to feel deep, lingering, and intensifies at night, leading to insomnia, agitation, and even depression. In some cases, people scratch themselves with brushes or hard objects until the skin breaks, yet the itch remains. If this itching comes along with mild jaundice, pale-colored stools, dark urine, or unexplained fatigue, the liver may be in trouble. Liver function tests and enzyme level checks can help clarify the cause. The sooner it's detected, the better the treatment outcome. Never ignore itchy palms, it may be your liver crying for help. Another uncommon but significant area is the ears. When the ears itch constantly, without any infection or visible wax buildup, it might indicate ear canal eczema or an allergic reaction to hearing aids. But what's more concerning is that ear itching can also reflect early neurological dysfunction, such as Parkinson's disease, multiple sclerosis, or cranial nerve damage. Research suggests that the trigeminal nerve, which controls sensation in the face and ears, can misfire when inflamed or damaged, causing a phantom itch. That means the skin appears perfectly normal, but the brain still perceives a deep itch. In elderly individuals, persistent ear itching could also result from reduced cerumen earwax production, which is the body's natural antimicrobial and moisturizing agent. When this is disrupted, the ear becomes dry, irritated, and vulnerable to fungal infections, especially in those who wear headphones or hearing aids often. Cleaning the ears with cotton swabs or sharp objects worsens the issue and may even damage the eardrum. In short, don't brush off itchy ears, especially if it keeps coming back. Seek an ear, nose, and throat ENT specialist or a neurologist to get it thoroughly checked out. Finally, we come to the most overlooked and vague type of itch, generalized body itching with no clear source. When seniors begin complaining about widespread itchiness, especially at night or after bathing without any rash, dry skin, or relief from creams, it could point to serious internal issues, including blood disorders or even cancer. This condition is medically referred to as pruritus sign materia, itching without a clear dermatological cause. It's considered an early symptom of cancers like Hodgkin's lymphoma, leukemia, multiple myeloma, or pancreatic cancer. While the exact mechanism is unclear, it's believed that inflammatory cytokines and chemicals released by tumor cells irritate nerve endings and trigger intense, uncontrollable itching. If the itching is accompanied by unexplained weight loss, persistent low-grade fevers, night sweats, or anemia, it's critical to run advanced blood tests, biochemical panels, and even CT or PET scans to look deeper. Another possible cause of full-body itching is chronic kidney disease. This common but underdiagnosed condition in seniors impairs the kidney's ability to filter out toxins like urea, creatinine, and phosphate. As these toxins build up, they irritate peripheral nerves, causing deep, relentless itching that worsens at night and does not respond to regular topical treatments. So, if you or an elderly loved one experience persistent full-body itch with no clear explanation, don't just blame the weather, treat it as a potential internal red flag. Itching, though seemingly minor, can actually be the body's way of sending urgent internal distress signals, especially in older adults. Each itchy spot tells a different story, carries a unique risk, and may point to chronic, degenerative, hormonal, or even life-threatening diseases like cancer. The key is to never dismiss the symptom. Don't just reach for over-the-counter creams or scratch until the skin breaks. Instead, listen to what your body is trying to say, because that small itch today could be the clue that saves your life tomorrow.